First off, what is the pelvic floor?
So you kind of can think about the pelvic floor as a hammock that kind of attaches to the front bone, the pubic bone, and back behind to our sits bones, the ones we're sitting on right now. And on top of that hammock is our bladder, our vagina, and our rectum. And all of that is really dependent on that hammock being strong.
Okay, why is it important for us to think about this part of our body more often? And what does the pelvic floor do exactly?
So it does so much, but the reason to keep it, if you weren't going to exercise a muscle, if you didn't know about that muscle, you wouldn't exercise it. You think about people that get in a cast, their muscles atrophy because they're not exercising them, right? So we don't necessarily think about exercising that part of our body.
Nope.
We kind of ignore it until things go wrong, like incontinence. Losing urine when I cough and sneeze and laugh. That is a huge problem in the United States, and it affects you as you get older, and that's a lot of the reason why, because the women's pelvic floors are not strong.
Okay, so you mentioned that link between the pelvic floor, the strength of it, and incontinence, which is a very common problem for so many women. You say it can also cause low back pain,
right,
problems in the bedroom. Elaborate on those things too.
So, if you think about that hammock, the strength, if you don't have strength in that area, other places have to compensate. So your back would have to compensate. Also, having a strong pelvic floor influences your ability to have a good orgasm. We all want to have good orgasms.
And everybody just started paying attention, right? Now, whatever they were doing, they dropped the dishes in the sink and go, what did she say? So these are all reasons we should care about it and think about it.
Right.
Okay, what do you have to do to get a strong pelvic floor?
So oftentimes women go to the doctor and say, I'm having problems in this area, and they get told to do Kegel exercises. And most women do Kegel exercises wrong. In fact, it's a squeezing kind of exercise instead of a pushing type of exercise. So we have physical therapists that are completely dedicated to making that area of a woman's body stronger. And then every time I say that to a patient, she goes, what do you mean I have to go to physical therapy to help that area? But yes, there's a whole division of physical therapy that works just on the female pelvic floor.
Really? So it's not a matter of just doing Kegels when you're at the stoplight?
Exactly. That's what everybody gets told.
Right.
Kegel exercises at the stoplight. But since you do them wrong, and if you did an exercise wrong, would you get any benefit from it?
No.
It's
not just, I'm sorry, but this is, since we're talking about it, it's not just a matter of squeezing?
Well, it is, but it's squeezing the right muscles, and it's making sure that you're not recruiting all your other pelvic floor muscles, that you're kind of isolating them. And so most women have to be taught how to do that, and that they could benefit from even like one session with a physical therapist. But there's also a whole line of products that help women kind of get in touch with that area of the body.
That's what you got here on the table today?
Right. These are all products that women can buy over the counter that will, they're inserted in the vagina, obviously, and then they help a woman kind of cue in to the pelvic floor. Like this one has a little bit of a motion in it. The one in the middle is a weight, and the one at the end actually does a little bit of vibration to remind a woman to squeeze. It does a 5-minute routine. So 5 minutes a day keeps the incontinence pads away.
and that's real. I mean, I think you're speaking to a lot of people out there. After you have children,
right?
Things don't always work exactly.
So that's a perfect time. A woman who's had a baby, that's a perfect time for her to begin to get in touch and strengthen her pelvic floor, because she's used that pelvic floor to push her baby out. So now she can use these devices to get stronger in that area after she did that.
Okay. You call the pelvic floor a stress container sometimes. Why is that?
Oh, women kind of hold all of their stress down there, and that's kind of the
we do?
theory. Yeah.
I thought we held our stress up here. I had no idea all that was happening down there.
And then we have to kind of learn to relax it, because many women are too tight there. They don't know how to relax that area, and that becomes, your mom always told you to suck in your gut and tighten that area. That leads to vaginal areas that are too tight, which can lead to painful sex.
Really?
Yes.
So how do you know if you are too tense?
So that's another, either your doctor or a physical therapist can, make that assessment when you go for your visits.
Oh my gosh. I wonder why Eugene isn't in the segment. I wonder why he chose to sit out.
You know what? Men need strong pelvic floors too. They actually help with erections.
Well, next time, Eugene can talk to you about that.
I don't have necessarily any devices, but
Oh, goodness me.
Oh, what time of the day is it? We are morning television, right? Dr. Alyse Kelly-Jones, really great information. Thank you very much. Visit NH Mintview OBGYN, NHMintview OBGYN.org for more information. You're really a great doctor. It's good to see you.
thank you.
Thank you.